Every day for the past few weeks, frontline workers have been risking their lives during the COVID-19 pandemic. Over 350,000 employees qualify for pandemic pay, but many who are in the trenches don't. One Markham-Stouffville Hospital clerk is speaking out, saying it isn't just about the money, but also the recognition.
They can't run clinics, they can't run the units without their secretaries. So there's no way that we can work from home. So if there's no way we could do that, then why aren't we important enough to get the pandemic pay?
This Markham-Stouffville Hospital clerk wants to remain anonymous out of fear of losing her job. She says she's always at risk due to contact with COVID-19 patients.
We're helping them with anything that they need, like appointments or schedules, little things like water, or if they need anything to eat. If they're, walking around, or if they need a blanket, we do all those things for them.
The pandemic pay is an additional $4 an hour on top of existing hourly wages. In addition, employees working over 100 hours a month would receive lump sum payments of $250 per month for the next 4 months. The list of who is excluded from receiving this benefit is a long one. Dietary aides, administrative workers in hospitals, people who sterilize medical equipment, just to name a few, says Michael Hurley, the president of the Ontario Council of Hospital Unions. He says half the hospital workforce is left out by the Ford government, further adding the program isn't well thought out for a group that's in a high-risk situation. Public Health Ontario says there are 3,947 healthcare workers in Ontario who have gotten COVID-19 at work. That's 17.2% of cases.
Everybody is under direct government's order to be able to be moved at any time. And so, they process this, they feel like they've been completely ignored in terms of their contribution and the risk that they're working under.
We try to focus on the people that are right in the trenches, like dealing face to face with people with COVID that are putting their lives on the line every day. And I bet there's another 500,000 people out there deserving too. We just don't have the money. That's what it comes down to.
Very frustrated and angry because we are just as much of a frontline worker as anybody else. And I feel like a lot of people forget that. We have the same patient contact.
The hospital clerk we spoke with says that the pandemic pay would be quite helpful right now, as her husband has been temporarily laid off. She also says the morale among her colleagues is quite low at this time.